In this session, we are going to see details about a fossa or a triangular depression seen in the upper limb region, that is between the arm and forearm region. You know, we have a joint between these two areas, that is between arm and forearm. We will be having a joint called elbow joint. In front of the elbow joint, that is in normal anatomical position, you can see a depression between these two regions. That depression is nothing but cubital fossa, and this fossa, it is a triangular depressed area, and above the cubital fossa will be having many major contents present in it. So we are going to see about it detailedly. So here in this picture you can make out cubital fossa in this area. So this is a triangular area where we will be getting cubital fossa. First, moving into cubital fossa contents, we have to know about how it is bounded. So cubital fossa, first it will be having boundaries in the way like cone. So you know, cubital in the sense cube, like cubital means we'll be having, according to the shape, we have a name called cubital fossa. It will be having apex, base and medial and lateral boundary. Along with that we will be having roof and floor. So now in this image you can make out the roof structures which are going to cover the cubital fossa. So here skin, superficial fascia and deep fascia is all removed. So after removing, you can make out some other superficial structures in the cubital fossa region. So once you remove all these structures, then only we can approach directly into cubital fossa. So this is the area where cubital fossa is present. After removing skin, superficial fascia and deep fascia, you will be having some structures present in the fascia. Those structures are remain. So those structures are, first one, here what you are seeing is bicipital aponeurosis. The aponeurosis is formed by the tendon of biceps brachii. While it is getting inserted, the tendon will get inserted in the radius, and the remaining part, it is going to form an aponeurotic sheath and then getting merged with the deep fascia present in the forearm region. So this fascia we will call as bicipital aponeurosis. And then we will be having two important cutaneous nerves, such as laterally we will be having one nerve called lateral cutaneous nerve of forearm. So that nerve we have studied earlier, which is nothing but continuation of a musculocutaneous nerve. So lateral cutaneous nerve is also a roof structure present above the cubital fossa. And then medially, if you are seeing, you will be seeing another important nerve, that is medial cutaneous nerve of forearm. So here we will be having medial cutaneous nerve of forearm, and then bicipital aponeurosis. Along with that we will be having another cutaneous nerve called lateral cutaneous nerve of forearm. So these are the important structures related to the roof area, and along with that we will be having a vein called median cubital vein also. So here you can make out a vein. That vein is nothing but medial cubital vein, which is connecting the cephalic vein with the basilic vein. So here between that we will be having one connection. Okay, that connection we will call as median cubital vein. So we will be having median cubital vein present here, and that is just above the bicipital aponeurosis. So median cubital vein is also coming under one among the structure of roof of the cubital fossa region. And then if you are making out, we can remove all these structures. After removing, you can make out the boundaries that is present medial and lateral to the cubital fossa clearly. So we can remove the roof structures here. So after dissecting skin, superficial fascia and deep fascia, the other contents also getting removed. Okay, so once you remove all these contents, you can make out only the muscle areas. So we are removing the structures. You can make out here. So if you remove all the superficial structures from here, you can make out some muscles also will be removed for our easy convenience to see the cubital fossa clearly. So here you can make out two boundaries. So this triangular area, think you can make out, it is a depression we will call as cubital fossa, and in this cubital fossa we will be having medial boundary and lateral boundary. So here you can make out medial boundary, and here you can see lateral boundary. The medial boundary is formed by lateral border of pronata teres. So this is the lateral border of pronata teres, which is forming the medial boundary for this cubital fossa. And then here we will be having another muscle called brachioradialis, and the medial border of brachioradialis is going to form the lateral boundary for this cubital fossa. So that's all about the boundaries present medially and laterally. So if you take about apex is nothing but it is made by approximation of these two muscles which is coming from medial and lateral side. So from medial side pronator teres, from lateral side we will be having brachioradialis. Both will approximate together to form the apex of the cubital fossa. And then we will be having base, which is again covered by a muscle called brachialis. So this brachialis muscle, it is one among the floor structure of the cubital fossa. So this is cubital fossa where we will be having roof structure we all seen already. So after removing the roof structure, we will be having medial boundary made by pronator teres, lateral boundary by brachioradialis, and floor is formed by brachialis. So once you remove brachialis also, what you will see, you can make out the bone clearly. So here we will be having a bone called humerus lower end. So in the lower end of humerus we will be having the floor of the it is forming the base of the cubital fossa. So in the base we will be having two condyles, that is from the lower end of the humerus bone, medial and lateral condyle connected by an imaginary line forming the base of this cubital fossa. So that's all about the boundaries you have to remember: medial, lateral boundary, and then we will be having floor muscles. Along with that we will be having apex and then base formed by an imaginary line drawn between medial epicondyle and lateral epicondyle. And now we will see about the contents of this cubital fossa. So talking about the contents of this cubital fossa, we will be having major contents as 4 in number. So that for easy remembrance, we will remember with a mnemonic called MBBS. Okay, so from medial to lateral, it will be structures. So all these 4 structures will be arranged in a order like MBBS. So first structure what we are going to see is a nerve, that is M, which stands for median nerve. So the nerve which you are seeing here is median nerve, which is seen in the cubital fossa. You already know this is cubital fossa where pronator teres is reflected, and then brachioradial is also reflected, so that we can view the contents clearly. So here from medial to lateral we will be having 4 structures. First structure what you are seeing is median nerve. M stands for median nerve. And second one is B. So B, which we already discussed, that is brachial artery. So here we will be having an artery present in the cubital fossa, we will call as brachial artery, and this brachial artery, it is dividing into 2 branches here. One is radial artery which is passing laterally, and another one is ulnar artery which is passing medially. So that is also will be considered as an content of the cubital fossa. So cubital fossa, first structure what we are seeing is median nerve, second structure is brachial artery with its 2 branches such as radial artery and ulnar artery, and then we will be having another structure that is also with a mnemonic B, and that is nothing but tendon of biceps brachii. So this is biceps brachii muscle of the arm region which is getting inserted in the radial tuberosity, and by means of a tendon is considered as a content of cubital fossa. You know, bicipital aponeurosis is also an insertion for this biceps muscle which we had seen in the roof of cubital fossa. So 3 structures you have to remember from medial to lateral. First one what we seen as median nerve, then we have seen brachial artery, and then now we are seeing tendon of biceps brachii. And one more structure which is present laterally is again radial nerve, which is again giving a branch called superficial branch of radial nerve. So we are calling with a mnemonic S. So now you can know MBBS stands for median nerve, brachial artery, tendon of biceps brachii, and superficial branch of radial nerve. I will repeat it from medial to lateral. First structure is median nerve, second structure is brachial artery, and third structure is tendon of biceps brachii, and fourth structure is superficial branch of radial nerve. So these 4 structures you have to keep in your mind to understand it in a better way. So that's all about cubital fossa. For now you have to know, that is boundaries and the contents present in the cubital fossa, how it is related and all. Now we will move on to the detailed description of this cubital fossa and how it is important in clinical aspect also. So in this class we are going to see detailed description of cubital fossa region, and along with that we are going to discuss about anastomosis happening around the elbow joint. So now first we will deal about the fossa or depression seen in front of elbow joint. So cubital fossa, it is a triangular depression seen in the front region or anterior part of elbow joint. So here you can make out a triangular depression in anatomical position. So this triangular area only we are calling as cubital fossa. So normal anatomical position you can make out some structures from our by using our naked eye only, such as cephalic vein, and here we will be getting biceps brachii, and this will be called as basilic vein, and this area will be having muscles such as pronata teres, and this vein is basilic vein, and this will be median vein of forearm, and this will be again called as cephalic vein, and here we will be having a connection which we will call as median cubital vein. And now talking about cubital fossa boundaries and contents. So cubital fossa, as I said before, it is a depression that lies in front of the elbow and is triangular in shape, as I said. So then it will be, as it is triangular in shape, obviously it will be having parts such as apex, base, medial border, lateral border, roof and floor region. So these are the boundaries we are going to see. Cubital fossa is nothing but a depression which lies in front of the elbow, and it is triangular in shape, and it will be having parts such as apex, base and two borders, medial and lateral border, along with roof and floor regions. Now we are going to see details of those. So now talking about boundaries, this picture what they shown is left cubital fossa. So here you can make out this is the medial aspect, and this will be called as lateral aspect. So medially we will be having pronata teres muscle. So this is cubital fossa. Medial border is formed by lateral border of pronata teres muscle. To be particular, you can tell it is formed by the lateral border of pronata teres, medial boundary, and then we will be having lateral boundary which is formed by medial border of brachioradialis muscle. So these are the two boundaries which is present medial and laterally. So medial boundary it is formed by lateral border of pronata teres, and lateral boundary it is formed by medial border of brachioradialis muscle. And then we will be having base, which you can see as a dotted line. It is nothing but a base, and this base is formed by an imaginary line which is joining two epicondyles of the humerus. So this is the humerus bone, lower end. Here on the either ends we will be having medial epicondyle and lateral epicondyle. So joining these two epicondyles we will be having an imaginary line. So that imaginary line is going to form base for this cubital fossa. And then we will be having apex. It is nothing but approximation of these two muscles which is forming medial and lateral border. So approximation of pronata teres along with brachioradialis going to form apex of this cubital fossa. So these are the four boundaries you have to remember now, and that is medial boundary formed by pronata teres, lateral border it is formed by brachioradialis, and base is formed by imaginary line which is joining medial and lateral epicondyles, and then we will be having apex formed by approximation of these two muscles. And then we will be dealing with other boundaries such as roof and floor. So about roof, after reflecting skin and superficial fascia, in the deep fascia we will be having some structures present, and those structures are going to form roof of this cubital fossa. So here in this image you can make out, so first we will be having skin, superficial fascia and deep fascia which we have removed, and after that we will be having structures such as median cubital vein which you can make out here. Connecting the basilic vein with the cephalic vein we will be having median cubital vein, and two cutaneous nerves will be seen. One is lateral cutaneous nerve and another one is medial cutaneous nerve. So this is left cubital fossa. So this will be medial side and this is lateral side. Lateral cutaneous nerve of forearm and medial cutaneous nerve of forearm. And then we will be having deep fascia along with bicipital aponeurosis. About bicipital aponeurosis you already know, it is one way of insertion happening in biceps brachii. So in roof we will be having skin, superficial fascia and deep fascia along with some structures such as vein and nerves. Those vein is median cubital vein and nerve is two in number. One is medially present and another one is laterally present. And medial nerve we will call as medial cutaneous nerve of forearm. Lateral nerve is called as lateral cutaneous nerve of forearm. And deep fascia again we will be getting one thickening. That thickening will be called as bicipital aponeurosis. And now here in this image you can make out median cubital vein. So in cadaver, if you are seeing, we can make out these two pattern of median cubital vein, either H pattern or else we will be having M pattern. So these two patterns will be common to occur in the shape of median cubital vein. And now talking about floor of cubital fossa. This floor of cubital fossa is mainly formed by two muscles. One is brachialis muscle, that is coming from the arm region, anterior compartment, and then we will be having a muscle called supinator, and this is the muscle of the posterior compartment of forearm. So these are the two muscles which is going to form floor of the cubital fossa. You can make out in this image clearly. So this is medial aspect and this is lateral aspect, and so this is also a left cubital fossa. So here you can see brachialis muscle lower part, and laterally we can see another muscle called supinator. So these are the two muscles which are going to form floor of the cubital fossa region. Now talking about contents of this cubital fossa, which is very important. So contents, so after reflecting all these regions, we will be having the triangular depressed area. So in that area we will be having four important structures passing through this, and those structures are, we are talking from medial to lateral. So from medial we will be having MBBS. In that way we will be remembering the mnemonic of this contents, MBBS, medial to lateral. So first one is median nerve. The nerve which we are going to see is median nerve. So this is medial aspect and this is lateral aspect. This image is a right cubital fossa. So in the medial aspect, first structure which is passing is median nerve. Then we will be having B stands for brachial artery, and then we will be having another B which is going to stand for tendon of biceps brachii, and then we will be having another structure which is present laterally, that we will call as superficial branch of radial nerve. So here we will be having superficial branch of radial nerve coming out. So these are the four structures you have to remember as the contents of cubital fossa region. So the order will be always medial to lateral. So medially M, median nerve, B for brachial artery, and another B for tendon of biceps brachii, and then we will be having S stands for superficial branch of radial nerve. And now going into details of these structures present in the cubital fossa. Talking about median nerve, this nerve, it passes downwards and supplies the pronator teres above the elbow. So it is passing downwards in this cubital fossa. Later, reaching the cubital fossa, it is giving a single branch. That branch is going to supply pronator teres muscle, that is present just above the elbow. And then we will be having this nerve leaving this cubital fossa between two heads of pronator teres. So we will be having an image which is showing pronator teres muscle. So this is pronator teres muscle supplied by median nerve, and this median nerve, while leaving this cubital fossa, it is coming out by passing between two heads of this pronator teres. This is humeral head and this is ulnar head of pronator teres, which we will deal later. Now you remember, we will be having median nerve coming out of the cubital fossa between the humeral head and ulnar head of pronator teres, and also from medial side of this median nerve, after coming out, it is giving many muscular branches which is going to supply muscles of forearm region, anterior compartment. So about median nerve, these are the three things you have to remember. First thing, it is going to pass to downwards and it is going to supply pronator teres muscle. Later, it is going to come out from the cubital fossa by passing between humeral and ulnar head of pronator teres, and after coming out from the medial side of this median nerve, we will be having many branches which is going to supply anterior compartment of forearm muscles. Now talking about artery, we have brachial artery, and this lies medial to the tendon of biceps. So we are seeing about second medial structure, that is first structure is median nerve and second one is brachial artery. And about brachial artery we have discussed earlier. About brachial artery, here in cubital fossa, what is happening is it is present or related medial to the tendon of biceps, and then it is dividing into two branches near to the neck of the radius, and those two branches we will call as ulnar artery and radial artery. According to their position, ulnar artery will be seen medially, radial artery will be seen laterally as shown in the image, and then we will be having tendon of biceps brachii as the Third content. So second content about brachial artery, it is just giving two branches in the cubital fossa, one is radial and ulnar artery. That information is enough. Now we will move on to tendon of biceps brachii. So about tendon of biceps brachii, as you already know, biceps brachii, it is taking origin by two heads, but while getting inserted, it is getting inserted into radial tuberosity. After inserting some fibers, while insertion, it is going and merging with the deep fascia of the forearm region, and these fibers we will call as bicipital aponeurosis. So inserted in the posterior part of radial tuberosity, bicipital aponeurosis extends downwards and medially from the medial margin of the tendon. Now talking about radial nerve, which you can see clearly in this picture. So this is the radial nerve, superficial branch we are seeing. Talking about radial nerve, it appears in the gap between brachialis medially and brachioradialis and extensor carpi radialis muscle laterally. Here you can see it clearly. So here we have brachioradialis muscle, and this will call as brachialis muscle. So between these two muscles, we will be having the peeping of this radial nerve coming out through the gap between these two muscles. So this is the lateral most structure present in the cubital fossa, and then they are going to the applied aspect of this cubital fossa. First thing you have to remember is cubital tunnel syndrome, where we will be having radial nerve, it will get injured. The condition where stretching of ulnar nerve is happening, we will call as cubital tunnel syndrome. So in the cubital fossa region near to the medial epicondyle, we will be getting some stretching or pressure getting forced in the ulnar nerve, which is going to cause this cubital tunnel syndrome, and this will cause numbness or tingling in the ring and small fingers, which you can see in this image clearly. So which will cause again claw hand appearance in the affected person. So ulnar nerve will get pressurized in the cubital region, we will call as cubital tunnel syndrome, and these are the images you can see. So due to fracture of ulna also, it is going to compress the ulnar nerve, and which will again lead to claw hand. Here we can make out how it is related, ulnar nerve, and how it is related behind the humerus and also the ulna. And talking about median cubital vein, as we already discussed, it is an anastomotic vein in front of the elbow, which is going to connect basilic vein and cephalic vein, and it passes upward and medially from cephalic to basilic vein, and it lies on the bicipital aponeurosis. You know, bicipital aponeurosis is a aponeurosis which is going to divide or which is going to separate artery from vein. That is, below this we will be having brachial artery, and above this we will be having median cubital vein, and it is one among the roof structures of cubital fossa. And behind is the brachial artery and median nerve, which we already know, and it is going to receive, that is, we will be having some tributaries coming to median cubital vein, that is median antebrachial vein, from the superficial palmar plexus. So this is an image showing clearly median cubital vein, which is a connecting vein between the basilic and cephalic vein. Talking about applied aspect of this median cubital vein, it is used for intravenous injections and also for blood transfusions, withdrawal of the blood, and cardiac catheterizations. And now we will go on to details about elbow joint anastomosis. Near to the elbow joint on both the sides, that is medially and laterally, we will be having anastomosis happening, and this anastomosis, it is divided into medial aspect and lateral aspect. So first we will clear out the anastomosis happening in front of the medial epicondyle. Now you understand this by detailed description what I am saying. Now I will show you a simpler image to understand it better. So now in front of the medial epicondyle, it will be having anastomosis happening between brachial artery and ulnar artery branches. So front of the medial epicondyle, we will be having inferior ulnar collateral artery and a small branch of superior ulnar collateral artery coming from brachial artery, getting anastomosed with ulnar arteries branches, that is anterior ulnar recurrent artery. Now we will see the anastomosis happening behind this medial epicondyle. So in front of medial epicondyle we have seen, now we are going to see behind the medial epicondyle. It is by means of superior ulnar collateral artery and a branch from inferior ulnar collateral artery of brachial artery. Anastomosing with, we'll be having another artery or branch coming from ulnar artery, that is posterior ulnar recurrent artery. So we'll be having anastomosis between the branch of brachial artery and branch of ulnar artery in this case also. So branches coming from brachial artery are superior ulnar collateral artery and a small branch from inferior ulnar collateral artery, and from ulnar artery we'll be having a branch called posterior ulnar recurrent artery. So that's all about the anastomosis happening in front and behind the medial epicondyle. Now we will look for the anastomosis happening in front and behind the medial epicondyle in an image. So here you can make out, we will be having medial aspect here and this is lateral aspect, and in medial aspect if you are seeing, we will be having superior ulnar collateral artery here and this is inferior ulnar collateral artery. These two are branches of brachial artery, and from the ulnar artery, this is brachial artery which is dividing into radial and ulnar artery, and from the ulnar artery we will be getting two branches which is arising medially, and the first branch what you are seeing is anterior ulnar recurrent artery and the second branch we will call as posterior ulnar recurrent artery. So this anterior ulnar recurrent artery going anterior to the medial epicondyle, and then it is getting anastomosis with inferior ulnar collateral artery of the brachial artery. So now if you are seeing behind, you can see dotted image. So that dotted lines indicating anastomosis between the superior ulnar collateral artery, a branch of brachial artery, with the posterior ulnar recurrent branch of ulnar artery. So that's all about the anastomosis happening in medial epicondyle, front and behind. Now we will move on to the anastomosis happening in the lateral epicondyle. So in the lateral epicondyle in front, we'll be having again branches arising from profunda brachii artery. You know, brachial artery, it is giving a thicker branch called profunda brachii artery. The profunda brachii artery, again it is giving one branch called anterior descending branch, which is otherwise known as radial collateral artery. So this radial collateral artery is going to anastomose with a branch from radial artery, that is radial recurrent artery. The arteries arising from the lower aspect we will call as recurrent because it is going to turn upside. So that's why the arrangement of the artery, by the arrangement of artery we are giving a name called recurrent. So anterior descending branch of profunda brachii artery anastomosing with radial recurrent artery, a branch from radial artery itself, in the front of lateral epicondyle. Same way we will be having in the posterior aspect of lateral epicondyle one anastomosis that is happening with the posterior descending branch of profunda brachii, which we will call as middle collateral artery. So middle collateral artery branch of profunda brachii anastomosing with again a branch coming from radial artery, that is intraosseous recurrent branch of posterior intraosseous artery. So in first one we had seen lateral epicondyle anastomosis in front, that is between the branch of profunda brachii and the branch of radial artery. Here in lateral epicondyle behind, we will be having anastomosis happening between a branch of profunda brachii artery and a branch coming from ulnar artery. The ulnar artery, it is giving an artery called common intraosseous artery. That common intraosseous artery again divides into two branches, that is anterior and posterior intraosseous artery. In that posterior intraosseous artery is going to give a branch called intraosseous recurrent branch. That intraosseous recurrent branch is going to anastomose with posterior descending branch of profunda brachii artery. So that's all about the anastomosis happening in the elbow or around the elbow in front and behind the medial and lateral epicondyle. Now we will see an simple image to make how the anastomosis is happening, to understand it much better. Okay, so here in this image you can make out lateral side. So this is lateral side, and here what you are seeing is anterior branch or radial collateral artery coming from profunda brachii artery, which is anastomosing with radial recurrent artery, a branch of radial artery. And here behind we will be having dotted image, that is nothing but posterior descending branch of profunda brachii artery, which we will call as middle collateral artery, again anastomosing with branch coming from the posterior intraosseous artery, we will call as intraosseous recurrent artery or intraosseous recurrent branch. So in this way anastomosis is happening around the elbow, medially and laterally. Now we will move on to an image showing this in a easy simpler way. So now we will see the diagrammatic representation of elbow anastomosis, where we will be having brachial artery, radial artery and ulnar artery anastomosing with its branches. Okay, so in front of elbow joint we will be having this type of anastomosis. Why this anastomosis is happening is while we are doing flexion action, that time we will be having kinking of blood flow. Okay, so to the distal parts blood flow will be less. So to make this sluggish or to make abundance blood flow to the distal part, we have to get this anastomosis. So if anastomosis is there, then it will be easy to get blood supply in the distal parts also while doing flexion action. So for that we have this anastomosis. This can be understood with a very easy diagrammatic representation. So this is humerus bone, as you know, arm bone, and in the forearm we have two bones. This is medial bone and this is lateral bone, that is ulna and radius. Now we have an artery coming in the arm region, and that artery we will call as brachial artery. So we have brachial artery here. So this brachial artery, it is coming towards the humerus and reaching the lateral part or head or neck of the radius. There it is dividing into two branches, and those branches we will call as radial and ulnar artery respectively. So near to the neck of the radius, it is dividing into two branches, so such as radial and ulnar artery. So the artery which I am drawing now is ulnar artery. So now we have this artery. Okay, so this is whole thing brachial artery. So this is brachial artery, right? So this brachial artery again will be having medial aspect and lateral aspect, and this is the artery called ulnar artery, and this artery will be called as radial artery. So now this artery is again called as brachial, which you already know. So brachial artery. Okay, now we have some branches arising from this brachial artery and ulnar and radial artery to form this elbow anastomosis. So to learn better, we will understand first one side, that is in the medial epicondyle. In front of medial epicondyle and behind the medial epicondyle, we will be having some type of anastomosis that is happening between branches of brachial artery and the branches of ulnar artery. So this is medial epicondyle. So in front of medial epicondyle, we will be having anastomosis happening between two arteries, that is from brachial artery we will be having two arteries coming in the medial side. One is superior ulnar collateral artery. So we will be having superior ulnar collateral artery, and then we will be having inferior ulnar collateral artery. So we will be having inferior ulnar collateral artery coming in front of the medial epicondyle. So this is medial epicondyle. So in front of the medial epicondyle, we will be having an artery arising, and that artery is inferior ulnar collateral. So this artery is inferior ulnar collateral artery. So this artery getting anastomosis with ulnar artery is one branch, that is anterior ulnar recurrent artery. So we will be having recurrent in the sense the artery is winding outwards and then anastomosing with the upper artery. So we are calling this as recurrent artery, and we are giving a name called ulnar recurrent artery, and it is present anterior to medial epicondyle. So anterior ulnar recurrent artery. Then we will be having behind the medial epicondyle two arteries are getting anastomosis, and those two arteries are again, so we will be having superior ulnar collateral artery. So superior ulnar collateral artery coming from brachial artery going behind the medial epicondyle. So here you can mark as a dotted point because it is going behind. So this is getting anastomosis with again ulnar arteries branch, that is posterior ulnar recurrent artery, which is also going behind to anastomosis with superior ulnar collateral artery. So this is again we will call as posterior ulnar recurrent artery. So we have anastomosis happening in front and behind the medial epicondyle. One is inferior ulnar collateral with anterior ulnar recurrent, and another one is superior ulnar collateral with posterior ulnar recurrent artery. Same way, if we go on the lateral side, In lateral side, we will be having anastomosis happening between the branches of profunda brachii artery. You know what is profunda brachii artery? It is an artery branch from brachial artery. So now we will get a branch from brachial artery. So brachial artery, it is giving a branch called profunda brachii artery, which is the major branch of brachial artery, and it is going to pass behind the humerus bone. So it is going passing behind, that is in the posterior aspect, and then after it is reaching the lateral side. So here it is going to give a branch called radial collateral artery and middle collateral artery, and in that radial collateral artery is otherwise known as anterior descending branch. So we will be having anterior descending branch, and then we will be having another branch called middle collateral artery, and which is going behind the lateral epicondyle, and that artery we will call as middle collateral artery. So this middle collateral and radial collateral artery is going in front and behind the lateral epicondyle, and then it is anastomosing with radial arteries branches and with ulnar artery branch. So radial artery, it is giving again one branch called radial recurrent artery, which is going upwards. So we are calling again as radial recurrent branch. So which is coming from radial artery, which we will call as radial recurrent artery, which is a branch of radial artery. And then we will be having another branch coming from this profunda brachii artery, we will call as radial collateral artery. So this is radial collateral artery coming from profunda brachii artery. And then we have middle collateral artery, which is going behind the lateral epicondyle, and which we will otherwise called as posterior descending branch. We will call this as middle collateral artery. So it is going behind the lateral epicondyle, and it is anastomosing with ulnar arteries one branch. Ulnar artery, it is giving a branch called common intraosseous artery. So this artery will be called as common intraosseous artery. So we will call this as common intraosseous artery. And this common intraosseous artery, again it will divide into two branches. One is anterior and another one is posterior. Imagine this as anterior branch, anterior intraosseous artery, and this is posterior intraosseous artery. And from this posterior intraosseous artery, we are getting one recurrent branch. So we are calling this as intraosseous recurrent artery, which is going behind and then getting anastomosis with middle collateral artery behind the lateral epicondyle. So this artery we will call as intraosseous recurrent artery, which is a branch of posterior intraosseous artery. That's all about the anastomosis. I will repeat again. So we are dividing into medial side and lateral side. So in front of medial epicondyle, we will be having anastomosis happening between inferior ulnar collateral artery, branch of brachial artery, with anterior ulnar recurrent artery, which is a branch of ulnar artery, and then we will be having behind the medial epicondyle on anastomosis happening, that is between the superior ulnar collateral artery, branch of brachial artery, and with we will be having posterior ulnar recurrent artery, branch of ulnar artery. So these two are getting anastomosis. I will mention. So in front, between the inferior ulnar collateral artery, anastomosing with anterior ulnar recurrent artery. This is branch of brachial artery, and this is branch of ulnar artery. Here behind, we will be having anastomosis between superior ulnar collateral artery with posterior ulnar recurrent artery. Again, this is a branch of brachial artery, this is a branch of ulnar artery. That's all about the anastomosis happening in front and behind the medial epicondyle. Now coming to lateral epicondyle, again in front, it is taking anastomosis between radial collateral artery and radial recurrent artery. So this is a branch of radial artery, and this is a branch of profunda brachii artery. So behind the lateral epicondyle, we will be having a branch coming from profunda brachii, we will call as middle collateral artery, which is getting anastomosis with intraosseous recurrent artery, and this is a branch of posterior intraosseous artery, and which again is a branch of common intraosseous artery, which again is a branch of ulnar artery. So that's all about the anastomosis happening in elbow joint. This is very easy to remember, only a diagram is little bit confusing. So if you practice again and again, it will be much easier for you to remember. So that's all about the elbow anastomosis details. So I think you people are very well thorough about cubital fossa and elbow anastomosis. Now we will move on to other region, that is forearm region.